Hi, I'm Dr. Juan Carlos Ibanez from the Catholic University of Cordoba in Argentina. I am going to share with you some of our investigations. Let me share with you my screen. And today I'm going to speak about how to transform complex cases into less complicated using Bio-Oss and Bio-Gide. First of all, this is my team. We work in Clínica Ibanez, our private office, and at the Catholic University, and this is my team at the university. When we think about bone and soft tissue modification, our goals are allow the placement of implants where it would not be possible to do so. Second, improve the position and direction of the implants, 3D position, get better aesthetic and function, and reduce complications. We do this through a modification of bone architecture and a modification of gingival architecture also. And in most of our cases, we work with guide bone regeneration procedures using biomaterials and barriers. And in most of the cases, we use Bio-Oss and Bio-Gide because these combinations is one of the most efficient and well-documented biomaterials that we have. All of us know the biofunctionality of Bio-Oss and know why it's very nice to use Bio-Gide. So with some cases, I'm going to give you some examples of the way that we treat our cases. In the first case, we are going to treat a female that need fixed teeth, but he has a lateral problem in the premaxilla and a vertical problem with a very big sinus in the post zone. And here we are going to plan as usual through a digital planning, so we can plan our surgery and our surgical guide in a prosthetic-driven way. In this case, we're going to use a surgical guide, a simple surgical guide for the 2mm burr. And after using the guide, we can open the tissue, cut the periosteum to give us a good closure at the end of the surgery. And then we are going to place the implant and perform the regeneration procedures. First of all, we are going to perform the sinus lifting with piezo surgery and piezo instruments and some manual instruments. Then we are going to fill with Bio-Oss alone the inner part of the sinus, and after fulfill the inner part of the sinus, we are going to place our implant, and after implant placement, we are going to fill the rest of the sinus. At the premaxilla, we are going, of course, to activate the cortical. Then again, I'm going to fill the lateral aspect of the premaxilla with Bio-Oss alone. And of course, we are going to cover it with some Bio-Gide membranes. Note that we are going to fulfill the premaxilla aspect and the gaps in the immediate implants also, and only mixing the Bio-Oss with saline and using Bio-Gide to cover all the premaxilla. Note that this is a membrane that is really easy to use and give us excellent results. Then we need to close, and here you can see what the surgical work ends. 6 months later, We have this aspect. Now we are going to go to implant exposure and soft tissue optimization, placing the abutments, take intraoral scanning, have the images for design our temporaries, mill them, and after have the temporaries, try them, look for the aspect in the patient, and if all is okay, we are going to go to the definitive restoration that in this particular case is a full zirconia restoration, screw retained, place the screw retained restoration in the mouse, and this is the final result, the final smile, and the final results in the X-ray. 1 year later, all is okay. The gum is going better, and 2 years later, we have this good result. When we have more severe atrophic bones, like in this case, we are going to treat it in a similar way. In the lower jaw, it's very easy because you need to do only an immediate loading traditional protocol, and in the case with a screw retaining hybrid prosthesis. But the problem is in the upper jaw. In the upper jaw, there's really no bone. This is the CBCT images that show that there is really a small amounts of bone in the upper. But now we are going to work doing sinus lifting in order to go up instead of down, because in this way the patient can use his provisional prosthesis. We open with piezo surgery the lateral window, place into the sinus our Bio-Oss, then the Bio-Gide, the final result after surgery. Look at the tomograph, and this is 8 months later. Now we can open the tissues, reopen, place our implants without any problem, using some native bone also, then make our initial stability measurements, and you can see here the nice ISQ that we can obtain in this regenerated bone. We wait 4 months, take impressions, make our hybrid upper prosthesis, screw retained one, and this is the final result without major complications. And the lady with his fixed teeth. We went from this to this in a relative easy manner. When we work with Bio-Oss alone, we achieve really good results, both in sinus lifting and in lateral bone regeneration. You can see the results in this research that we have just published this year, when the quarantine began. And in another research, you can read that a very nice height of regeneration can be achieved. The density of the regeneration zone is good. There's no major difference between small particles and large particles. And really the new bone that can be achieved is really good in terms of percentages. This combination can be improved, of course, yes. You can mix Bio-Oss with autogenous bone, and there are several researchers that show us that we can improve the results mixing Bio-Oss with autogenous bone, like you can see in this case. But is there other way to improve the results? Our experience of 10 years show us that mixing Bio-Oss with mesenchymal stem cells give us really good results. We are using adult stem cells, hematopoietic and mesenchymal ones, taken from the bone marrow. There are several researches that show that when we use bone marrow mix with Bio-Oss, the results are really good. We can take the bone marrow from different bones. In the first cases, we took the bone marrow from the posterior iliac crest, but nowadays we are using bone marrow taken from the distal femur. The Narbona and the McCarthy and another researchers show that the viability and the quantity of stem cells in the distal femur is good enough for bone regeneration. So we go to the lateral face of the distal femur, just above the lateral epicondyle. And in this area, we go through the skin and the soft tissues with a trocar, a 4 millimeter diameter trocar, and through the lateral aspect of the distal femur, we go into the bone, through the bone marrow, and we can aspirate in an easy way the quantity of bone marrow that we needed. We can show how to mark the stem cells in the bone marrow taken, and we use the bone marrow for this type of cases. From here to here, you can show you the results just after the surgery and 6 months later, where I can show you a really good regeneration of the bone that allows us to place implant in an easy way. There are several research that show that Bio-Oss with the stem cells is a good combination. So in this type of cases, with severe atrophy of the maxillary, we go from here to here using this combination, Bio-Oss and bone marrow. We presented this research in several congresses. In this particular presentation, 12 sinus were treated with bone marrow mixed with Bio-Oss. We place implant and we take some biopsies during implant placement with the Trifine, and the results show us that all the sinus had a good heal. The implant success was very high. The vital bone obtained in terms of percentages was really good, and the ISQ, or the initial stability of the implant, was good enough. What are or which are the indications for this type of mixture? We only use when there is a severe reabsorption of the jaws, or in patients with systemic pathologies that compromise the heel, or local pathologies that compromise the heel. And so this type of cases look at the severe resorption of the maxilla, the digital planning, and the final results with the fixed teeth for this lady. In this another case, you can see another severe resorption of the upper jaw. You can see here the CBCT, the clinical aspect, and here you can compare the clinical aspect with the CBCT, a very narrow ridge. We go in the posterior with the sinus lifting. We take the bone marrow from the distal femur, as we were talking about, and then Bio-Oss mixes with the bone marrow, Bio-Gide, and the final result after the surgery. You can see the CBCT here, and 9 months later, you can see how good is the bone that we achieve in this three-dimensional view. You can see again, and then we are going to plan of course, digitally the surgery, obtain a surgical guide, go through the guide for full guided surgery, and place the implant with a nice insertion torque and ISQ values. 4 months later, we optimize exposure the implants and optimize the soft tissue, place the abutments, again go with our intraoral full mouth scanning, and prepare the provisionals. This is a provisional hybrid screw retaining prosthesis. When we are satisfied with the result with the provisionals, we go to the full zirconia restoration in similar way that we saw before. This is a screw retained restoration. A nice smile for this very nice lady, and the final result with a full digital no rocks treatment from the beginning to the end. Now she's wearing this type of restorations, and we go from here through this to this and to this final result. You can read about details of all the technique and our actual data through 10 years in the Journal of Stem Cell Research and Medicine. This publication is now in press, and here we describe how to achieve 100% of success in sinus lifting, 4 to 5 millimeters improvement of ridge width, and a high success and survival rate in implants, and a high success and survival post-loading rate. In conclusion, the use of a combination of Bio-Gide with Bio-Oss allow, mixed with autologous bone or mixed with bone marrow with stem cells, lead to excellent results in GBR. I want to thank my team for the support, and I want to thank Geistlich for the support also. Thank you very much.